Well, the South African government, as part of trying to prepare itself for any potential coronavirus outbreak here in the country, it has advised hospitals in the province of Gauteng and to gear up themselves. They say they are prepared to treat patients should the coronavirus hit South Africa. Tembisa Hospital in Ekurhuleni is one of them, and my colleague, that's ENC reporter Kaelihle Khumalo, is there this morning. Kaelihle, a very good morning to you. You are in Tembisa Hospital, just east of Johannesburg in Ekurhuleni. That's one of the hospitals that we understand the health department has designated to be prepare itself, gear up for any potential outbreak of the coronavirus. But we know that in recent history, Tembisa Hospital, particularly last year, has had its fair share of challenges. We've had, I think, about 10 babies who've died there due to hygiene issues, due to bacteria.
Well, certainly, Braden, but there has been a great deal of assurance from management here that they are on course in making sure that should there be the case in South Africa, they are able to attend to it immediately. But also the significance of the hospital is that it's very close to our Tambo International Airport. And where we are, actually, Braden, it's actually an isolation room where a patient can be taken in and be treated and be given adequate attention. And joining us now is the hospital manager, and of course that's the CEO, Dr. Mokhalab. So, Doctor, thank you so much indeed for your time. So, in terms of your own preparation as the hospital, how ready are you should we have a case?
We are actually ready. We have actually done all the necessary preparations to ensure that at least patients are actually adequately attended to and managed before they get to be transferred to the center of care like Steve Biko.
And also just looking at your preparation, do you think all the measures you have in place are sufficient to deal with the cases, should you have any?
Yes, we do actually have measures sufficient to deal with the cases, because you have to bear in mind there is no outbreak in South Africa as yet. There might be isolated cases, but the department and the National Institute of Communicable Disease said the virus is not here in South Africa. This is our precautionary measures, and within the confines of the precautionary measures, we are prepared to actually be able to deal with everything possible within this room.
And just actually looking at this room in terms of the measures that you have put in place, it's a very isolated room. So I would imagine that you're really taking as much vigilant attention as possible in making sure that you're able to render a very good service.
Yes, this room is actually just at the entrance of the hospital, at the casualty services. Its openings or its entrances and exits are actually more to the outside. So we try to actually take every measures possible to ensure that the patients that are isolated and actually recognized or are suspected as coronavirus infected are managed here before we could actually transfer them out. So they do not actually have to intermingle with the broader hospital community of patients, but we deal with them here. All the necessary equipment have been stored in this room to ensure effective outcome and effective management.
And maybe just before I let you go, Doctor, I would imagine for you as management, it must have been a bit of an honor to be chosen as one of those hospitals, because I would imagine you do have challenges of your own. We saw the reports in November and December, the baby's case. But I would imagine now that you are geared up for this enormous task.
Well, this is a reflection of the tenacity of the type of management and staff that I work with. We never are cast as blame to anybody. Every challenge that we face, we introspect and try to check how best can we actually intervene in future. And when this task befell us from the Minister of Health, we actually summoned all our forces and ensured that we are ready to be able to deal with the task in hand. Not actually to moan and say we are incapable, we are from actually a CRE outbreak and how can we get this? No. We have got the people who are dedicated, will always use the resources at our disposal, although limited, to effectively carry out the clarion call from our country to help in terms of actually the possible income of this disease in the country.
All right, Doctor, thank you so much indeed for your time. So certainly, Braden, very clear assurance from Tembisa Hospital that they have all measures in place in making sure that should there be an outbreak, especially around Gauteng, they're able to be responsive and attend to that particular case. And perhaps if I might try to give you an idea of the isolation room where we are. So this is one of the beds that may be used for the patient. And as you can see, they have all their ducks in the row really to make sure that they render a very credible service and make sure that they are able to attend to this particular case. Should we have an outbreak in South Africa, to date in this country, there is no coronavirus. So back to you, Braden.
Yes, indeed, no reported case of coronavirus yet. These are all precautionary measures. Thank you very much. Khayelihle Khumalo on the ground in Tembisa Hospital here in Gauteng now.